and hair today. And many of you who know me will know that I have a very dear friend and an esteemed colleague who I've known for many years, actually. And Sajjad Rajpar is a general dermatologist, so a skin specialist, but he's had a lot of training in the whole body as well. More and more, there are lots of skin specialists that are popping up who are just looking at the skin on our face, trying to make us look younger and not thinking about the skin as an organ. So I always have loads of questions about skin and hair. So I thought I would invite him on a Sunday to ask him more. So I've had quite a few questions on my Instagram already, and if you've got questions that you want to ask, you can put them in the chat, and I will quiz him. But I just thought I'd start firstly, Saj, by saying thank you, and thank you for all your work that you do.
Pleasure, pleasure. I'm looking forward to being quizzed.
So it's very interesting about skin, and I know I talk about this quite a lot, and I've talked to you about it before. Lots of people think skin equals a woman's face equals vanity. Now, recently some guidelines came out, and there was a sort of consensus statement with the International Menopause Society, and they were saying that we should absolutely never use HRT just to improve skin and hair. And I sort of felt a bit annoyed in some ways because it was almost dissing skin, like skin doesn't really matter. Now, if I was only taking HRT to try and look younger, okay, we can talk about that. You know, there's some social issues or whatever, ethical issues with that. But in my mind, the skin is an organ. And you can explain more about that. But if I'm taking HRT to improve my skin, i.e., have less dry skin, have less thinning of my skin, have less risk of ulcers, like venous ulcers, and if I had psoriasis or eczema to improve the quality of my skin as well, surely that's still quite important. Like, why do we think the skin is just like something that covers our body, or in a woman, it's just the face?
And I think, Louise, I entirely agree. It is so much more than just facial aesthetics. And in fact, I have a slide that says skin is more than facial aesthetics. Please, can we move away from this concept that reducing your facial lines means your skin is healthy or that you are healthy? That's completely not the case. And I think it's really important to appreciate that 70% of women around the perimenopause and menopause have symptoms arising from their skin. And the skin, as you said, is a really important organ. It's one of the biggest organs in the body and has important structure and functional aspects to
Mm.
it. So it's not just the aesthetics, it's the structure of skin that matters. We need integrity in our skin that's resistant to tearing and heals well when there's an injury. And we need the skin to function properly because, of course, it's the first and foremost barrier. It keeps the
Mm.
outside out and the inside in. And we often call or refer to the outside out being kept out as the skin barrier. And it's really important to understand that hormones affect the skin barrier, and that is a basic function of the
Mm.
skin. So, really, we need to move towards functional improvement of the skin, symptomatic improvement of the skin, structural improvement of the skin. And yeah, if your skin also looks better for it, that's a bonus, but that would not be
Mm.
the primary aim.
No, it's very interesting. I actually, I don't know if you know, I wanted to do dermatology at some
I
stage.
didn't know that.
Yeah, so it was,
What?
I wanted to do oncology, so cancer medicine. And then when I did my member of the Royal College of Physicians and I was deciding on my specialty, I realized oncology wasn't for me. It wasn't quite holistic enough because a lot of oncology is about studies and trials, and sometimes people are forgetting the bigger picture. And I like using my general medicine. So then I actually thought, well, skin is something that's everywhere, obviously, and it has a really important effect. And my pathology degree, I spent a lot of time looking at skin for women with systemic sclerosis, looking at the type of collagen called type 4 collagen and how it changes in these women mainly. And their skin. So I did a lot of biopsies, a lot of analyzing with molecular biology techniques. And it was then like looking down the microscope at skin, realizing how it can change at a molecular level, thinking how dynamic it is, and how it can really transform someone's life if they haven't got a skin issue. And it just made me think differently. But then I thought, well, I don't know, I can't pronounce half the Latin names that skin conditions are called. And I thought, I'm not sure that that's right for me. So then I applied for a job in Manchester, but Manchester skin department's really, really popular. I didn't get shortlisted. I think it was the first time I'd never been shortlisted for a job. And I thought, oh, this is the sign. And then I went into general practice. But
Louise, I did not know
did you not
that
know
at
that?
all. I did not know that you are a collagen expert, and really, I should be directing all my collagen questions to you.
Well,
No,
it's
I didn't
interesting,
know.
isn't it? So, but the skin is the largest organ in the body, isn't it?
Well, yes, that
Or is
is
it?
said often, but actually, probably by surface area, the lungs are the largest organ. I'd like to think
Yeah.
the skin is number one at everything, but the
Mm,
lungs have the largest surface area, and the musculoskeletal system has the largest weight. But nonetheless, the
mm,
skin is an extremely important organ,
mm,
and it's interesting that you mentioned that we need to look at skin holistically. If we just take itch, for example. There are so many causes of itch, and if
mm,
you haven't got your training in general internal medicine and you haven't treated patients on the hematology ward, on the infectious diseases ward, you might miss several causes of itch. That could
mm,
include problems with the kidneys, problems with the
mm,
liver. Certain
mm,
forms of cancer, like lymphoma, can present with itch. Certain forms of infection can present with itch. And that's all sort of the internal health system or your wellness showing on your skin.
mm,
So sometimes the skin, and often the skin, is actually an insight into somebody's well-being and how fit and
mm.
well that they are. And that's really one of the most interesting things that I find about skin, which is that we get an insight into somebody's general health status,
Yeah.
without even asking a question.
Yeah, and you know what? Perimenopause and menopause, itchy, dry skin is so common. And I shudder when I think about women I saw as a GP. And like you, I did a lot of medical training. So people with itchy skin, often waking them up at night, really awful, come and see me with scratch marks down their back. I would make sure they didn't have kidney disease, liver disease, a lymphoma, all of these things. And then I was often stuck. And do you know what, Saj? I never once thought about their hormones. And I'm thinking back, they were all women in their 50s, 60s, 70s. And I did them such a disservice because I did not think about it at all. And now I see women, obviously, they don't come only with dry, itchy skin, but it's one of the things that often melts away when they have their hormones balanced properly. Um, but the skin is a window, really. I'm very interested, as you are, preventing disease. We want to be kept as healthy as possible. We don't really want to be seeing doctors. But when our skin generally, so I'm talking about our general skin ages fast, then it can affect it. It's sort of like a window into our internal organs, isn't it?
Yeah, absolutely. I think, one really important observation is when your skin thins, it is likely to predict if you're peri and postmenopausal that your bones are also thinning. And this observation
Mm,
is, decades, centuries old, that women who had translucent skin were much more likely to have bone fractures. And this is where
mm,
your skin is giving an insight into what's happening on the inside. And it's no surprise because skin is about 80% type 1 collagen and bone is 90% type 1 collagen.
mm,
In the bone, we have osteoblasts that build bone. In the skin, we have fibroblasts that build skin and build collagen, and both have estrogen receptors.
mm,
And of course, if we've got an estrogen deficiency, then we're going to have thinning in both organs almost in a
mm,
linear fashion. And so, this is a classic example of where your skin gives an insight into what's going
mm.
on inside.
It's really important because I know when you were talking at the conference that we organised in March, you had pictures of people with sort of more wrinkles, sagging of their skin, and saying which of these people are more likely going to have osteoporosis. And this is really important actually, because one of the reasons I take HRT is to keep my bones strong. I just got this, I'm so scared about osteoporosis, especially of my spine, actually. So anything I can do, and of course I eat healthily, of course I do weight bearing exercises, but actually anything to build, like you say, get those osteoblasts working really well, build the collagen, build the structure of my bones. But again, structure of skin is really important. And I know when I was perimenopausal, my skin really changed. And I remember often looking in the mirror, I was just cleaning my teeth in the evening and just thinking, oh, it just didn't have the same texture. And it felt very sort of dry, but also quite lifeless, almost like the blood wasn't getting to the skin in the same way. So, like, probably felt almost like I wasn't getting enough oxygenated blood to the skin, but also not enough venous return as well. And it's a weird thing when you think, well, I haven't changed anything. My diet hasn't changed, my exercise hasn't changed. Like but that's quite common, isn't it, when we don't have hormones?
Yeah, I think it's down to the fact that I think virtually every single type of cell in the skin has got receptors for estrogen. And without estrogen levels being at their optimum, the skin does change. And it's not uncommon for people to come into the clinic saying they feel they've got dull skin, that they've got sagging of the skin, that they've got dry skin, and that the appearance of the skin has changed significantly in a short period of time. We actually know from studies looking at women who've had surgical removal of their ovaries that the skin changes can develop within 6 months of a surgical menopause. So it does not take long for the skin to react adversely from being void of
Mm,
estrogen. We
mm,
also know that women may potentially lose 30% of their collagen in the first 5 years after menopause. So there is a rapid change, and that's why people describe this change so rapidly. So that's the
mm,
collagen, where the structure of the skin, but also the function of the skin. So our skin produces its own natural moisturizing factors. This includes things like sebum, which is like a greasy substance that keeps the skin well hydrated, ceramides, which are like the cement between cells that keeps the cell barriers really watertight and stops soaps and pollution and other things penetrating the skin. And also our own hyaluronic acid, which is a substance that just holds water and keeps your skin plump. And all these three things will decline in many women around the perimenopause and menopause. So it's not uncommon that their skin feels different, that it feels drier, that it's reflecting light differently because the composition of the
mm.
skin has changed. And that's where perhaps the appearance of dullness may arise when nothing else has changed. So yeah, there are actually many profound changes, both at the cellular level, at the molecular level. There are also changes in the hair follicles as well, and we also know
Mm.
that around 40% of women will have problems with hair loss around the perimenopause and menopause. So yeah, it's a vast and important topic.
And it's really important it's that we don't think just of estradiol, because the other hormones are really important as well. And lots of people are really worried about testosterone and think testosterone will cause hair loss. But actually, for most women, when they have a normal female physiological range of testosterone, hair growth can improve, and skin can improve as well. A lot of people think their skin's going to become spotty and oily. But actually, a lot of people find that their skin texture improves with low dose testosterone as well.
Yeah, this is indeed the case, and there's actually published data to suggest that if your testosterone levels are very low, remember testosterone is anabolic. That means
Mm,
it stimulates growth, and that
mm,
includes growth within the hair follicle structures. So, if both in men and women, in fact, if your testosterone levels are zero, both men and women will find that the hair quality and quantity goes down, both on the scalp and on the body. And a study showed that replenishing women with very low levels of testosterone back to sort of normal levels, physiological levels, as you mentioned, actually stimulated hair growth rather
mm,
than caused hair growth. Now,
mm,
I would just say there are a small number of women for
mm,
whom they might be sensitive to testosterone. And it is actually sometimes hard to get somebody bang in the
mm.
physiological range, isn't there? There's a period where,
Yeah,
people
absolutely.
are stabilizing. And there are a small number of women where potentially they might be sensitive to androgens, both on their scalp and their
Mm,
skin. But it is unanimously the case when I see patients who say, look, actually, I do think that this is, the testosterone's flaring my acne. And there are some women for whom this is the case. None of them wants to come off it because of
no.
all the other positive benefits of
Mm,
testosterone that they are experiencing. And it's often the case that when their levels are physiologic and they are having some skin or hair symptoms, we can usually manage those with skin directed and hair directed treatment. So there's no reason why somebody can't still
yeah.
benefit, even if they are in that minority that seems to be sensitive. But for the majority of people, there are generally positive benefits. And testosterone is a potent stimulator of sebum secretion. Sebum is important not just on your face. We always think about sebum and acne on the face in teenagers. It's actually an important molecule all over the body. We create sebum all over the body, and that helps lubricate the skin and protects it from getting dry. It's your own moisturizer. And when
Mm,
your sebum levels go down, your skin becomes more dry. And this is why many women on testosterone will actually experience better quality skin in terms of hydration and also dry eyes. How many
mm.
women will mention, what, my skin and my eyes feel less dry because in the eyes you've got sebaceous glands that are specialist for the eyes called meibomian glands. And they also are stimulated by testosterone, and produce a similar, oily substance that lubricates the surface of the eye and reduces surface eye disease.
Yeah, dry eyes is so common. And actually,
Yeah,
some people
totally.
get watery eyes because their eyes are dry. So they go out to the cold environment and their eyes are streaming, but they still have dry eyes. And it can
Yeah.
be very, very commonly associated with testosterone deficiency more than the other two hormones, actually. It's well recognized and well discussed in the literature about testosterone and dry eyes. I mean, there are lots of reasons why people can get skin changes. There's lots of reasons why people can get hair changes, but there's sort of dry skin and dry hair loss. The texture of hair can really change when people don't have hormones, and any changes to hair can take several months. So if you started a treatment or didn't have, so say if you had iron deficiency and then started iron, it can take a while, can't it, for your hair to change and show.
Oh, Louise, this is so important because understandably, people are really impatient and they think if they don't see a change straight away, that that can't have been the case and that they're still
Yeah.
going to have more hair loss, even though it was the correct treatment. I always tell my patients that it's going to take 8 to 12 months to begin to see recovery
Mm,
from reversing a potential cause. And that includes genetic causes as well.
mm,
And don't forget, hair is growing what at a rate of a centimeter a month or something like that. So if you've got long hair and you're assessing, your ponytail width, then that's going to take even another year or two potentially
mm,
before you're actually going to be able to visibly feel that. But what we see under regular follow up is the starts of hair growth, the beginnings of hair growth.
mm.
And using a magnifying glass and a dermatoscope and a trichoscope, we can monitor, that somebody is going in the right direction. But really, for them to see, it can take months, and that's entirely the case.
So patience is a virtue, but
Yeah,
it
it's
is really
difficult
difficult
though.
because there are so many things that affect our hair growth. And I know myself a few months ago my hair felt thinner, and then I had my estradiol level done, and it was actually quite low. And despite using higher than licensed doses of patches, just because I don't absorb through this great barrier that my skin is, I know when I started my HRT, I was perimenopausal, and I'm sure aged 54,
Yeah.
I'm menopausal now. So I naturally just needed a little bit more estrogen. And I think the last few months my hair's got better again, and it's the only thing I've changed. So it probably is related, but you have to wait until you really know whether
Yeah.
it's made a
Uh,
difference or
uh,
not.
yeah, and there's some interesting data to suggest that it might be that it's actually the skin of the scalp that the estrogen is really improving the quality
Mm,
of. And that, and when you mentioned the blood vessels, we've got tiny little blood vessels. What's the
mm,
microvasculature? And in fact, some of the treatments for hair loss actually dilate the blood vessels and improve hair growth that way.
mm.
But there is some data to suggest that actually it's the improvement of the skin surrounding the hair follicles that is
Mm.
responsible when
Which
you
makes a lot of
correct somebody's.
sense, doesn't
Yeah,
it?
yeah, it's like getting the
Mm.
soil right. If you get the soil
Mm.
right, then your grass will grow better. Feed
Yeah,
the soil.
so we
So
don't
yeah,
really need to be buying menopause
oh,
labeled shampoos or face creams, do we, Sav?
I hate nothing more than the surplus of menopause branded products on the shelves and online and on social media adverts that promise to restore estrogen deficiency or restore the
Mm.
signs of estrogen deficiency. And there is no way that these products are able to do that. And I
Mm.
looked at, there was a period where I actually assessed
I
several
know.
products, and I checked all the ingredients really carefully and determined what the active ingredients were and what those ingredients would do. And it was fair to say that they were all reasonable products. They would all
Mm.
help
Yeah.
skin. They might be good moisturizers, or they might have, minor anti-aging benefits. But there was not one product that would only be specific for peri or postmenopausal skin. Those products would equally work well in a man or a
Mm.
premenopausal woman. There was nothing
Mm.
unique in them. There was certainly
No.
nothing specific for the menopause. So it's all a marketing game.
Mm.
The only way to treat the signs of estrogen deficiency is with estrogen. It's in the name, isn't it?
Yeah, for
So
sure.
you kind of the only way to treat the signs of thyroid deficiency, by the way, is with thyroid hormone. And
Mm.
I don't see, the only way to treat iron deficiency with iron. So
Mm.
kind of we've got to be really, really transparent that these products I do think mislead, and it's a really vulnerable bunch of group of women where you're experiencing symptoms, you've got the hair loss, you think, right, I need to take those supplements, that collagen supplement, that multivitamin product that promises immediate hair growth. And I see patients who spend hundreds of pounds a
Mm.
month,
So do I.
hundreds
Yeah.
on, yeah.
Yeah, and it shouldn't happen. So we've got a few minutes left. I've got loads of questions that came through today on my Instagram. So I'm just going to quick fire you some questions if that's okay.
Let's do it.
Um, so why is my skin so itchy? So you have mentioned that itchiness is very common.
Yeah, so a few causes of itching. It could be because you're dry because of the sebum and ceramide reduction, so you could do with moisturizers and avoiding soaps. It could be because of the nerve endings. Sometimes the nerve endings transmit abnormal signals and give you the sensation of itch
Mm.
or the sensation of insects on your skin, which is known as formication, and all
Yeah.
these strange and weird burning symptoms, pins and needles, tingles, itch.
Mm.
So sometimes it's the nerve dysfunction from estrogen deficiency as well. And another not uncommon cause of itching is too much histamine in the skin. And sometimes,
Mm.
taking an antihistamine can calm the histamine in the skin. So there's at least three causes to look at. But again, that we said there's so many causes for itch, aren't
Yeah,
there? Liver, kidney,
absolutely. It's really
thyroid,
important to see
iron.
someone who
So see
understands.
somebody who
Yeah.
understands and wants to check you over properly.
So periorbital dermatitis, never had it before. Could it be hormone related?
Indeed, 1 in 7 of us is born with the genes that predisposes us to dermatitis. And dermatitis, by the way, guys, is another word for eczema. And potentially, if you're prone and you're potentially perimenopausal and it's drying your skin out, then the thin eyelid skin may be the first to show this, because it's
Mm.
very much more prone to irritation, especially because we're using skincare products on that area, potentially makeup products on that area. And when we shampoo ourselves and wash our faces, we might get little collection of that sort of shampoo product in that area. So
Um,
it may not. So not all changes at the
no.
perimenopause or menopause are going to be from that, but it is worth being evaluated for sure.
Yeah. Um, 24-year-old, she's on the contraceptive pill for 6 years, but her hair's frizzing, starting to curl, odd grey hair. So this is interesting, isn't it? Because contraception, I've spoken about before, is actually all artificial hormones,
Yeah,
synthetic
yeah.
hormones. So they will block the action of estradiol and progesterone and testosterone. And I see a lot of people with mental health symptoms, mood changes, but also dry, itchy skin when they've had an implant in, especially, but hair changes too. So it could be related, couldn't it?
I indeed believe this. I absolutely hate synthetic hormones. I have to say,
Mm,
the number of women who come with acne from various combinations of synthetic hormones, either progesterone only or even
mm,
combined. And it is entirely feasible that, there could be changes in the hair that's related. Um, Sometimes there are other causes for hair loss and change in hair quality, and I think it is worth getting checked
mm.
over. If you've got a strong family history of hair loss, it is worth just being checked over for even hereditary type changes as well. But indeed, hormones could be responsible too.
Yeah, I did a podcast with Sophie, who you know, my middle daughter, that came out a few weeks ago, and she was saying so many of her friends go on birth control, so contraception, for their skin, but often it doesn't help.
No, the success rate is around 50%. So it
Mm,
definitely does not help 50%. And I think a handful of those actually really get worse from it.
yeah.
And then there's potentials for side effects, isn't there? It's the weight
Mm,
gain, the mood
yeah.
changes, and all the other side effects. It's a quite a heavy dose of estrogen or synthetic estrogen
But
as well, isn't
yeah,
it?
absolutely. So increasingly, we give women natural hormones, even when they're young, because they can use other forms of contraception and then have natural hormones. What about collagen supplements? Are
Oh,
they
don't get me
worth their
started.
money?
Please don't get me started. I'm going to give you a very short answer on this one and say at the current time I'm saying no.
Yeah, well, we haven't seen good evidence, and it sort of doesn't make sense anyway. And you want to treat
No,
the underlying
no,
cause. So, if
no.
the cause is a hormonal deficiency causing the collagen loss, you're better off having hormones, really, aren't you?
And just one
Um,
quick addition here, make sure that your diet's rich in protein, that you're getting
yeah,
enough of the
yeah,
natural collagen or nutritional
absolutely.
values. Yeah,
Quite a few questions about acne flares, rosacea. Um, could that be related to hormonal
definitely.
changes?
Yeah. 10% of perimenopausal and early menopausal women will report an acne flare. So, a very simple explanation might be that the estrogen level has dropped more than the relative testosterone level, therefore the hair follicles are seeing more androgen. But it's far more complex than that. And I think just sort of swings in hormones upset sebaceous structures and hair follicles. And it often, more often than not, actually, women who get perimenopausal acne also had acne as a teenager,
Mm.
may also have had a history of PCOS, so have a history of something related to hormonal acne. So, yeah, not uncommon, actually, really not uncommon.
Yeah, and the other thing that happens often during perimenopause and menopause is there's an imbalance of hormones. So often there's more testosterone relative to
Yeah,
estradiol.
exactly. Yeah,
So although testosterone tends to reduce as we age, estradiol reduces very quickly after
right.
menopause. So people think that they've got too much testosterone because of the skin changes, and often rather than blocking testosterone, giving them
Giving more,
estradiol,
yeah, get the
and they
balance
might
right.
even need some testosterone once the estradiol's in,
Yeah.
can make a real difference, can't it?
Yeah, yeah, yeah. If you've got your estrogen back to baseline, then that allows you to bring the ratio back.
Yeah.
But yeah, absolutely. It is a common problem and it can happen quite quickly. I've seen women,
Mm,
who have developed quite moderate to severe acne in a period of 3 to 4 months.
mm. So I'm going to end there. We have done quite a few podcasts before, and we've got articles on my website as well about skin and hair. One of the things that, just to leave on a negative thought, really, is that there's incredibly little research about skin changes, hair changes, and hormones. A lot of it is using synthetic hormones. We haven't got any up-to-date studies really that are going on at the minute, and there's a lot we can learn. There's a lot. I'd love to be looking more about the different types of collagen, for example, in skin and their effects. Sajjad and I found an article many years ago showing that women who have venous ulcers really reduces the
Yeah.
incidence of venous ulcers if people take hormones. Now, just looking at that itself, it's millions and millions of nurses' time, dressing time, NHS time, dressing these ulcers in these women, and it's painful. They reduce
Oh God,
morbid,
yeah, yeah, yeah.
they reduce motility and mobility. Um, you know, and they're so much more common in women, of course, aren't they?
Yeah, yeah,
So
yeah.
we need to be thinking more about the skin as s- an organ that's really important for us, not just a cosmetic sort of device almost.
Yeah, absolutely. You know, if we've got an intervention here that could reduce venous leg ulcers in women by a third, why aren't we using it? What else could that intervention do? And it's going back to, can we improve the structure and function of the skin? And it is apparent that we can. So yeah, we definitely need to do some more research.
Yeah. So there's loads we need to do. Thank you very much, Saj, for joining today. And I
Pleasure.
hope you all enjoy the rest of your time. But go onto the website, have a look at what else we've got over there, and enjoy the rest of your day. Thank you.